is Dr. Kate Hurley. I'm the director of the Correct Shelter Medicine Program at UC Davis. Upper respiratory infection for homeless cats, which means somewhere between 2 and 4 million cats every year are exposed to a shelter environment. And respiratory infection is by far the most common disease that they get, and it's the first or second most common reason for euthanasia. That's why it's such a concern to me, because it is really, we believe, preventable. And the first challenge for us in doing this upper respiratory infection project that we're doing with the Morris Animal Foundation was just figuring out a way to document how much respiratory disease there is in animal shelters. Because when you have 300 cats at a time and things are kind of hectic and some of them are sneezing and some of them are getting better and some of them are getting sick and some of them aren't getting noticed, it's really hard for me to go to a shelter and say, well, how much disease do you have? When you started using this vaccine or this disinfectant, did it get better? Did it get worse? And we had no system. So the first part of the project was developing a system for shelters to count how much respiratory disease that they had. And we do that through having them enter their respiratory disease cases into an online database. Some shelters had 50 times as much respiratory disease as other shelters. And we're talking about some shelters where 80 to 90% of cats will get sick in shelter care, versus another shelter in the project where 5% or less of cats get sick. Phase 2 of the project, of course, is to say, well, why? Why are we seeing these differences, and what can shelter A do differently to be more like shelter B that has the low rate of respiratory disease? Because it's stress associated, we can't just look at infection. We have to look at the well-being of the cats and what are the factors that influence their well-being. And we're looking at housing. We're looking at not only what disinfectant they use, but how do they clean? How much are the cats moved around and disrupted during cleaning? What's their ventilation like? What's their exposure to dogs and dog barking? One of the things that we noticed is that a dramatic difference between the shelters with the very lowest respiratory disease rates and the other shelters that had higher respiratory disease rates was the manner of housing for cats that had just been admitted to the shelter. And you can imagine, this is, for a lot of cats, the hardest thing they will ever have to face. They are in a new environment. Either they were stray and they were out in the field somewhere, hunting and in the grass and out in the sunshine, and all of a sudden they're in, sometimes a stainless steel box about 2 feet by 2 feet in size. There's other cats, there's the sound of doors clanging shut, there's maybe dogs barking, there's weird smells, they have nowhere to hide, and right then is when they get maybe the first vaccine they've ever gotten in their life. They are being fed a new food that they might not like, and they need to withstand an assault of infectious disease like no animal should ever have to face. They need to respond to the vaccine, and they need to show the kind of friendly, outgoing behavior that is going to make an adopter fall in love with them and take them home. What a challenge for an animal. The great thing about this is that if we understand what causes respiratory disease in cats, we also understand what's making cats stressed and unhappy in shelters. If we correct it, we get a double bonus. We control this disease that is killing many cats in shelters because they just don't have the resources to get them healthy again in some cases. And we also can make sure that the 4 million cats that pass through shelters in the United States have a better time. And that is so worth doing.